When we first started to talk about limb malalignment, you said we don't tend to think about things like patellar luxation or some types of hip dysplasia as malalignment issues. And I think that's very true. When I think about limb deformities or malalignment, I think about the basset hounds that have their feet turned around and twisted out to the side.
And 8 years ago, that's what we thought of. When you would hear the term angular limb deformity, you thought of the basset hound that has his feet on sideways. And certainly it's pretty malaligned. But as I have studied this topic over the years, what I have learned is there are so many different orthopedic conditions that at their roots can also be attributed to diseases of malalignment of the limb. And as you just mentioned, patellar luxation is a great example. When I was a young resident, we thought the patella was the problem. What we've learned now is the patella is never the problem. The problem is the femur is malaligned or the tibia may be malaligned. And most of our correction strategies are aimed at realigning the femur and the tibia. Another great example is a very specific kind of elbow dysplasia, which is coronoid disease. And there's a subcategory of that can be called medial compartment syndrome, where the dogs will develop severe osteoarthritis in the medial compartment of their elbow. And there are many investigators now who think that this may be as a result of malalignment of the humerus to the radius and the ulna, which can put excessive force and pressure on that. So the topic of limb alignment really goes beyond the classic deformity of the basset, and it really does apply now to all of orthopedics. We are now looking at old conditions through new eyes and studying their limb alignment to find out if that is the root source of that secondary disease entity.